Today, we have the opportunity to ensure that California stays firm in being the leader of reproductive justice and freedom. I introduced Senate Bill 729 this year, in my first year as a legislator, because I made a commitment to Californians when it came to health and reproductive justice, to ensure that we are addressing this over 30-year-old discriminatory law when it comes to who gets access for family services. So SB 729 is looking to mandate large healthcare plans provide and cover services for infertility, services for IUI, services for IVF. It's looking to also expand the definition of what it means to be infertile.
It's about ultimately the ability to decide when and if you want to start a family. That includes the ability to make the decision that you are not ready or that you are ready and you need the help. Infertility affects 1 in 8 people in this country. So we need to make sure that we are creating the right public policy environment for those that have those issues, such as myself, that they can seek and get the care that they need.
And then as I learned more about women who will forego chemo, who will find out they have cancer, and say, you know what, I'm going to go have a child and I'll come back in a year. Some of who get sicker and then tragically pass away. And I felt nobody should be faced with that simple choice of deciding to have a child or deciding to get well. And so that was the genesis of SB 600, which took several times to get through the legislature, and we were ultimately able to pass it. And I believe we were the first state to pass legislation to require health insurance to cover the storage of fertility.
As already stated, it hits everyone. It doesn't matter who you are, where you come from, what your economic status is, but it's very clear that those that have the money can go on to take care of themselves and, have their families and look forward to the future, while those that don't have the means don't get that opportunity. And I think it's a travesty that only if you have financial means you get to experience the joy of having a family.
This is a reproductive justice state. There's no reproductive justice in the current bill. There are too many patients I can't even see because they know they don't have access, or patients I see and I recommend to them the best evidence-based care of IVF, but it's not covered because it's specifically excluded. We have to be able to give, as physicians, as healthcare providers, the best evidence-based medicine for any disease with which we diagnose a patient.
I have seen numerous recurrent pregnancy loss specialists over the past 9 years, and all of them have recommended IVF with PGTA genetic testing to improve our chances of a healthy pregnancy. But as a self-employed professional here in California, no policy we can purchase covers IVF treatment. It's not just self-employed and those working for small businesses that are affected either. Many essential workers, such as nurses and teachers, do not have access to coverage for infertility and IVF services and do not receive a salary high enough to pay for those treatments out of pocket.
As a queer person wanting to create a biological family, I needed medical assistance to achieve this dream. I wanted to have a family for all the reasons my straight friends and family do, but I faced different barriers in a system that is largely heteronormative. This system includes a doctor that assumed I made decisions with a husband and assumed that a male partner helped me with months of injections. This process takes a harsh physical and mental toll, and it shouldn't also be such a daunting financial one. I am blessed beyond measure to be expecting my daughter, but the road to get here was long and exhausting.
Now, after 2 cancer diagnoses, 10 years apart, my ability to conceive has been severely compromised. I chose not to preserve my fertility in order to expedite my life-saving cancer treatments, and am now paying for costly IVF treatments with very limited fertility coverage. Through my own experience and through my work, I know how painful and difficult it is to lose your fertility because of cancer. Young people facing cancer want to live, but surviving is not enough. We want to lead active and productive lives. We want to take part in our communities, and many of us want to have children.
So let's ensure that we are the leader in reproductive justice here in the state of California.